Hello everyone! Today we will be talking about PTSD and medications. Specifically, names of commonly used medications in the treatment of PTSD, uses, expectations, and side effects. For some people, PTSD can feel like their brain is constantly stuck in survival mode, always alert, anxious, or overwhelmed. Medication can help create space for healing by easing these intense symptoms. Antidepressants are often prescribed even if the person isn't depressed, because these medications can calm the nervous system, reduce anxiety, improve sleep, and help with mood swings. What antidepressants do not do is erase trauma, replace therapy, and they are not happy pills. They cannot do all the work on their own, but can make it easier to process trauma, especially when combined with therapy. All medications have two names, a brand name and a generic name. The differences between these names is minor and will not be addressed in this video. All you need to know is brand name is quite a bit more expensive than generic. Here is a list of these medications on the screen. We will try and do a segment on each individual medication in a future session. Not all of these are FDA indicated, but are still used in practice to treat PTSD. We also can use medications like prazosin or clonidine to help treat nightmares. Compared to other medications, antidepressants do not work right away. You can expect after 1 to 2 weeks some small changes, like better sleep or slightly less anxiety, but the majority of people don't feel much yet. That is normal. After 3 to 6 weeks, most people start feeling noticeable improvements in mood, energy, or thinking. Symptoms like irritability, sadness, or panic may start to ease. It is around 6 to 8 weeks the full effects of the medication will kick in. Some people may need a dose adjustment or a different medication if symptoms haven't improved. Some people find relief with medication, some don't, and others may need to try more than one option. That's normal, and working with your provider to find the right fit is key. Now, side effects are very similar amongst all the antidepressants. The most common ones you may experience are nausea, upset stomach, headache, drowsiness, trouble sleeping, and increased anxiety or restlessness that lasts maybe a couple days. The good news is that these side effects go away within a couple weeks and can be helped by taking with food for upset stomach and at bedtime if they make you tired. One side effect that does not go away is sexual side effects, which are described as low libido, delayed orgasm, or erectile issues. If this occurs, I recommend contacting your doctor to discuss treatment or alternate medications, especially if this is impacting a relationship. While these medications are usually well tolerated, it is important to contact your doctor if you experience suicidal thoughts, especially in the first few weeks, severe agitation or panic, unusual bleeding or bruising, and extreme fatigue or confusion. I know after hearing all this it may cause you to worry, but please know these are potential side effects that may never occur. It is important to keep in close contact with your medical provider if any issues come up. As always, your medical appointments are confidential and will not be released to friends or family without your consent. I know this is a lot of information. So if you have any additional questions, please comment and we will try to address them in a future video. If you liked this video, please like and subscribe. Thank you.